Can physical therapy help with bloating? Yes, and most people are shocked by that. If you're someone who always feels bloated, constipated, or like your stomach won't deflate no matter what you eat, pelvic floor physical therapy may be the missing piece. Hi, I'm Dr. Jessica Babich. I'm a board-certified doctor of physical therapy specializing in pelvic health, orthopedics, and holistic head-to-toe recovery here in New York City. In my practice, I treat many patients who struggle with chronic bloating, constipation, gas trapping, fullness, or abdominal distension, and nothing they've tried has worked. Their GI doctor has already looked at their diet, their labs, and their medications. Their endoscopy, colonoscopy, and blood work are all normal. They've done the supplements, the water, the fiber, and they still feel miserable. So today we're going to talk about how pelvic floor PT can actually help, why it works, and what kind of results our patients are seeing. First, bloating is not a stomach or intestines issue. The pelvic floor plays a huge role. Your pelvic floor is not just about bladder control or sex. These muscles coordinate bowel movement. For a bowel movement to happen, the pelvic floor needs to relax. The abdominal muscles need to gently push, and then pressure has to move down and out. But in many people with chronic constipation or bloating, the pelvic floor does the opposite. It tightens and holds and pushes in the wrong direction. This is called dysenergic defecation, and it keeps stool and gas trapped inside the body, leading to discomfort, bloating, distension, and that never fully emptying feeling. Pelvic floor PT retrains that system so that the body can let go. A lot of the research on constipation and outlet dysfunction is done using biofeedback, and the American Gastro Association strongly recommends it. Biofeedback is a machine that uses sensors, either on the skin or internally, so that patients can see their muscle activity on a screen in real time. But in real life pelvic PT, biofeedback is so much more than a machine. It can also be visual or auditory cues. It can be manual feedback from a therapist. It can be breath and coordination training, posture and pressure retraining, and then learning how to relax and contract using cues. You can also use movement to retrain the nervous system. Biofeedback simply means helping your body learn a new pattern with feedback. And that can be high-tech or totally hands-on. The research is clear. Biofeedback-based pelvic PT improves constipation and distension. Many patients see a 40 to 60% improvement. Results last because the system actually relearns how to work. But muscles aren't the whole picture. Constipation and bloating are rarely caused by one muscle. Pelvic PT looks at the whole pressure system. So your diaphragm, the abdominal wall, the pelvic floor, along with your posture and your core coordination, all influence your bowels. If you hold your breath, brace your abs, suck in your stomach, or strain on the toilet, you're pushing pressure into a system that can't release. So breath work, posture, and coordination training creates space so that stool and gas can actually move. And your organs need to move too. Some people hear visceral manipulation and they think it sounds strange until you realize something simple. Your organs actually move. Your heart beats. Your lungs expand and recoil with every breath that you take. Your intestines glide and contract to move digestion forward and through. Your abdominal organs shift with posture and breathing. When the organs lose mobility, either from inflammation, surgery, posture, scar tissue, or pressure, motility slows. Gas gets trapped, stool backs up, and this causes the abdominal muscles and the abdominal pressure to distend. So visceral manipulation can restore that mobility. It's gentle, it's safe, and it's based on normal physiology. When organ movement improves, the motility improves. Your lymph and your blood flow improve. Abdominal pressure reduces. The nervous system calms, and bloating and distension decreases. If your gut can't move, it can't work. So what does treatment look like? There is no one-size-fits-all protocol. Treatment depends on the person, not a template, but it often includes pelvic floor muscle down training and relaxation, improving push mechanics without straining, training the diaphragm and the core to manage pressure, using biofeedback, either through high-tech or low-tech, visceral mobilization, toileting posture and bowel routine strategy, nervous system regulation to reduce gut tension. Most patients start noticing changes in a matter of weeks, not years. So who benefits the most? Pelvic PT can help anyone with bloating that gets worse as the day goes on, abdominal distension after meals, constipation or incomplete emptying, gas that just feels trapped, anyone who is straining or pushing to empty, or if you need to use a finger or pressure to help stool pass, along with pelvic floor tightness or pain. It's also helpful for those who have tried fiber, laxatives, probiotics, elimination diets, and they still feel bloated. Because if the pelvic floor can't relax, nothing moves, even with the right food. The results are real. Research shows significant improvement in constipation, bloating, abdominal distension, and incomplete emptying. My patients say things like, I finally feel flat by the end of the day. I'm not scared to go out to dinner anymore. Or I can actually fully empty for the first time in years. It changes quality of life in a real way. So yes, physical therapy can help with bloating, not by treating it like a stomach issue alone, but by treating the muscles, pressure, and mobility that make digestion possible. If you've been living with chronic bloating or constipation and nothing has helped, pelvic floor PT may be the missing link. Drop questions below, hit like and subscribe, and I'll see you in the next video.